Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation. And today I am chatting with Brad Younggren. He is the Chief Medical Officer and President of Care Innovation at 98point6. And we are going to dive into some very interesting news that has just recently come out of this virtual first primary care provider. They've raised another $20 million, adding to their coffer. So now I think you guys are at 267 million, give or take a million. Been around since 2015, and you're making a very, very interesting move of getting into the health IT infrastructure space to help health systems deliver virtual first primary care. So we are going to unpack all this with Brad, but first, please join me in welcoming him. Brad, it's great to have you here.
Thanks for having me. Appreciate it.
All right, this press release that announced the fundraise and then also did a little pirouette into this news about becoming an infrastructure company really caught my eye. But before we unpack all of that, I'm wondering if you can just introduce 98point6 to those who may not have really been familiar with the company. Like I said, you guys have been around since 2015, so anybody who may be newer to the industry may have missed all of the groundbreaking work that you guys have done in primary care. So introduce us to 98point6 and tell us a little bit about what you guys do.
Appreciate the opportunity. Yeah, so we started in 2015 under the fundamental belief that technology could have the greatest impact in healthcare by targeting primary care. And we are primarily a text-based platform, which allows us to leverage that data set to improve automation, to increase the efficiency of care delivery. We started working with self-insured employers, and then we moved into health plans, and as you mentioned, more recently, directly with health systems. But mostly focused in the early years on how can we provide tools and technology to help initially physicians. Now we have multiple different kinds of operators on our platform, deliver better, high quality care more efficiently. And so that's the journey. It's been a good 6+ years now. I don't know, maybe longer than that now, where we've been focused on initially on this notion around care delivery. And then we sort of moved into the notion of what else is going on in primary care, and that has to do with patient aggregation. When you're aggregating patients, you're trying to provide value. What are the kinds of technologies you can apply against that to improve value for the patients in the context of their primary care journeys?
All right, so talk to me about this licensing thing, because this is really interesting. This was like I said, in that fundraising press release, $20 million you guys raised. So in addition to all the funding that you've already garnered. But what was curious to me about it was the fact that it's like now you're licensing out your tech and you're licensing it out to health systems. And you even got your first client. So it's multi-care health system coming out of Washington. But tell me exactly about this product. So what is being licensed? Is it the text-based stuff? Is it the video visit stuff? So are you competing now with like Amwell and Wheel and some of those infrastructure virtual care providers? Do you guys have like an EHR kind of product that's attached to that? It seems like that's a very in vogue thing for a lot of these self-contained primary care groups to have. So, I mean, tell us exactly about what's being licensed.
Yeah, I think it's, from my perspective, it's a really exciting time that our technology is finally at the place where we can reflexively empower health systems to use it. But it's really everything we've spent the last 6+ years building. We're just now empowering health systems to utilize that technology more effectively in their own care delivery models. So it's everything. We have spent a lot of time on multiple automation techniques to improve efficiency in care delivery, to improve quality in care delivery. We have our own medical group of over 60 full-time and 120 part-time 98point6 physicians who are delivering the care every day at high volumes for our employer and health plan clients. All that technology we built is very similar to what we will be offering health systems like MultiCare as they create a sort of digital-first approach to managing their health system populations. The ones they have or the ones they're acquiring. So we're working with MultiCare and Indigo Health to really support that digital transformation and experience. And so that's incredibly exciting. So it really ends up being everything. It's all, I always like to say half of our engineers are working on provider-facing technology, which is a little bit different, and half of them are working on patient-facing technology. And so they really get to benefit from both of those lenses in areas we've spent incredible amounts of time fostering a plan and a process around to change the way that physicians or clinicians, more generally speaking, can use technology to deliver the care they've always wanted to deliver. We haven't ever gone to the FDA with full automation. We have always looked at what we're doing as being extending the reach of the clinicians. And that started with physicians. Now we have APPs. The technology supports nurses and behavioral health therapists as well now. So it's very broad, and allows pretty much everyone who touches healthcare from a traditional perspective in a brick and mortar setting to leverage those same kinds of expertise in the digital space.
What is the attraction to the health system market right now for you guys? Because I think that's an interesting client group to go after, particularly with this whole virtual first, out of the box infrastructure approach. I mean, what was it about this market? Why place your bet there?
Well, I mean, I have spent the last years. Well, I'm a physician by background, so I've always believed that we needed to ultimately leverage our technology in a way that allowed health systems to benefit from it. Because even me as a patient in Seattle, Washington, I identify very closely with the health system that I receive my healthcare from. I still think health system branding has a large place and a very large part of our GDP, and I think that it was just a necessary part of the evolution of the product. I think what we also learned over the last few years is most health systems, not all, but most health systems, do not have a very robust product engineering workforce that they can leverage to compete in market, especially as all healthcare will have a hybridized model in time, in my opinion. There'll be digital healthcare across all aspects of healthcare in time. And what way can a health system compete in the marketplace against engineering powerhouses, people who have tons of experience and discipline in developing and rolling out software technology? And I think that's really what we were hearing in the market is, can you be that service organization for us? You have expertise. You spent all these years building this care delivery technology and patient aggregation technology. We need it. Can you provide it for us? And really evolving our strategy around supporting health systems to really take advantage of that has been critical. I think the other key thing in addition to that is that with a lot of the entrances of either private equity backed players in the primary care space, or to your point, Amazon getting more deeply involved, especially with the One Medical acquisition, health systems are seeing front and center the direct competition in their geographic market space for patient acquisition and management on the primary care side, which we all know has an impact on downstream patient management for chronic diseases. And there's, I think if you ask health systems, what I hear is it's a disintermediation movement where the health systems are becoming disintermediated from holistically all the other work they're doing for patient management with some of this primary care entrance into the space. And we're not really being looked at as being a competitor to them. We're merely being a supportive functionality, bring our expertise and a lot of the experience and lumps we've taken with scar tissue around delivering this kind of product in the employer space and the health plan space. That knowledge can be reflexively used to support health systems as well. As an example, I've had to build a large learning and development team. How do you train doctors to use innovative and unique technology that no one knows how to use other than your own doctors? Well, you have to have a robust learning and development team to deliver that for new clinicians coming on, but also for every product release that happens, you need another training program. So that's another component. So I think some of those teams that we have internally will be used quite handily or quite often within the health system model.
I think this is interesting. To me, this puts you into a competitive space that's a little bit different. Like to me, it's like how you're now competing to me with Wheel or with Amwell or with some of this other IT infrastructure, especially in the telehealth space. I mean, you have a differentiated offering, but I'd like to hear in your words, like how do you think your offering is differentiated from some of those other players who have more of that virtual first kind of approach to technology and don't necessarily have the care delivery expertise that 98point6 has? Like how do you guys feel like you stand out and compete in that space, particularly among those coveted health system clients?
Well, I think our focus in the health system space is creating this new sense of flexibility for them. I think when you ask health systems really what their needs are, they do need some flexibility. Like they don't want to be necessarily bound to the EMR that they've purchased, although it's this massive investment and that's not going away, of course. So a lot of our focus is how to integrate and work with their existing electronic medical records they have in-house for the majority of the health system, and to allow that bidirectional flow of information and empower clinicians to have that kind of data. I think our approach has been first and foremost on delivering technology and care delivery. Everything else has happened since then, but that was our focus from the early days. So when you look at video-based technology companies, we were never focused on video. We certainly do video visits, we do phone visits, but the vast majority are partially or completely done via text. So from the beginning, our focus has been on how do we leverage that knowledge? Because for the first time, we were really the first company, other than Babylon, I'd say, that were in the room of every case. That's one of the reasons I was excited to come to 98.6 was from the clinical perspective, to be in the room of every case, because you have the real data. It's not the rendition of the visit as demonstrated by the physician's note in an EMR. It's really what's happening in the room. And when you have access to that and knowledge, that improves quality tremendously. When a third-party physician can go back and look at the transcript, they can figure out what happened in the visit, and that imparts knowledge around your product roadmap, or what are the kinds of technology you need to improve quality and the care delivery side. I mean, and we're also not a staffing company at our core, like some of the other companies that have come on the market the last 2 to 4 years. We do have our own medical group, which makes us relatively unique. There's certainly others that have medical groups, but we started from the beginning with the notion that we needed our own independent medical group, primarily because we needed the physicians, initially physicians, now many clinicians, bought into the notion of what we were doing. We needed them not only on the boat, they need to be rowing the boat with the technologists. We didn't want to have 1099s floating out there, delivering the care. We wanted the clinicians to have non-care delivery time, which all the core physicians, as we call them, have. They have time carved out on their week to work with the product engineering teams or the user experience teams to look over what are we doing, how can we make it better? And that component of our medical delivery model has really helped us innovate faster, because the clinicians for the first time are not just looked at as being, you go deliver the care, we're going to figure out how best to deliver you the technology you need. It's actually just, it's an interesting model where product engineering and the medical team have to learn to work together. So it's not like a traditional tech company where it's product engineering. It's this PEM model, as I call it, which is, how do you develop it? How do you create a prioritization or product roadmap? You have many new interesting stakeholders when you build it that way, which makes it very unique.
I love hearing that. Thank you for all of that, insider insight on the model. I love hearing that. On the medical delivery side of that, I have to ask, because it makes me wonder, what happens to that medical delivery side of the business now, particularly because of this increased emphasis on selling out or licensing out the technology side of it? Does the medical delivery side ultimately go away? Does it grow with it? What's in the plan here for that other side of the business, the core side of the business?
Yeah, I mean, we continue to grow. We have new relationships this year with health plans. We continue to grow our self-insured employer business. I think there's tons of value in growing that business. So it's not like a pivot for us. It's really just realizing that finally the technology is robust enough to deliver in a more SaaS-oriented model to health systems. And so I think that we'll continue to grow our medical group as needed to support the health plan work and to support the self-insured employer work. And then we'll be growing the health system support work in a little bit different way. I think as an example, I had to build this workforce management team to really understand how to do 24/7 on-demand care. And a lot of those experts come from fields that are not in healthcare, by the way, as you can imagine. Service-oriented call center industry people, experts on queuing theory, data scientists, all that. And so those teams, I think, will be certainly relevant for our internal practice, our internal medical group, as we grow the employer base and the health plan base. But I think that the health systems will have the opportunity to use those teams in a different way, which is we want all our primary goals for the health systems to be successful in their work. And I think for them to be successful, they're going to need to leverage these administrative teams we built that support our own medical group. So it's sort of a yes and approach. And, as we move into building new technologies on care delivery, whether the idea comes from the needs of the health systems or from the self-insured employers, it's largely irrelevant. It benefits all parts of the business, really.
All right, Brett, I have a follow-up question on some of the product talk that we've been doing before we move on to the higher level market type stuff I want to pick your brain about. But I have to ask, what is patient aggregation? You mentioned that a couple of times, and I'm curious to know what that means at 98.6 and what kind of technology you've developed to do that.
I mean, I think holistically, what I describe to people is when I came to 98.6 from Q Health, I was excited about learning how to build technology to help clinicians deliver better care faster. But what you realize is that there are many non-clinical tasks that are part of primary care. And when you're aggregating like large volumes of patients on the platform, sometimes really what they don't need is a clinician. I can say that being one, or certainly don't need a doctor. If you have a lab follow-up question, a nursing function, or directionality, there are many companies that started in like CareNav as an
Yeah.
example. So CareNav is just part of what we have to do as a company, because we need to refer patients to subspecialists. So we need to refer patients sometimes to inpatient care. Sometimes we need to refer patients to an emergency department if they have an emergency going on. Patients still come into the clinic with an emergency sometimes, despite it being the wrong place. Sometimes they just don't know that.
Nowhere
And
to go.
so,
Yeah.
so that's when I refer to patient aggregation, it's a lot around that, which is how do you, remote patient monitoring, care navigation, giving the patient what they need at the right time. When we built the company, I always describe the analogy, you would open the door virtually and there'd be a doctor on the other side saying, how can I help you today? What's evolved over the last 7+ years is now we have much better sense of with our people, but also with our technology around figuring out what it is the patient needs in the moment, and then providing either the right technology or the right human in front of that patient to deliver that best patient experience for them. So you're getting better experience, better patient satisfaction, and you're delivering the outcome you wanted to in the first place. So that's kind of my sort of high level perspective on patient aggregation.
I like that. It's like, to me, it sounds like just removing the friction out of the healthcare process for a patient. Like, it just sounds like it makes everything so much more simple.
Well, yeah, we always believed that we needed to increase patient engagement in virtual digital healthcare to deliver the outcomes we wanted to. So we had to create a pricing model that would allow patients to come in as many times as they want. You come in for a simple question, why go to a search engine? We can come in and have trusted information from a clinician, chronic disease, acute care medicine, preventive care, all of those things. So that has to be built in the model. And once you're getting patients coming in for all these different reasons, and they're engaged and trust the platform, then you can really start to deliver the outcomes you want. We have employer contracts that sit above 50% utilization. I mean, it's literally like it flips the tables on what you hear about from traditional analog video telemedicine services. And once you get to those levels of engagement, you have the most incredible opportunity to impact outcomes.
I mean, I would say not even just on the digital side, but even on the primary care engagement. I think that there's a lack of engagement with primary care too, right? I mean, like generally speaking at a population level, I mean, everybody may have a primary care doc because they might need to, but not everybody participates in primary care. At least that's what I've read.
Yeah. Yeah. And there's so much value in, I mean, traditionally many of the companies rolled in with, synchronous virtual care. And then I think we do, mostly semi-synchronous at times because we're always attributing clinicians to the work. Now there's a lot more asynchronous work going on. You have RPM work, but all of it has its place in primary care, in my opinion. I mean, all of that together will create the holistic digital experience that will increase engagement and ultimately will lower the cost of care delivery, not only through just like the model of how primary care is delivered, but how downstream subspecialty care is delivered because of what happens in that primary care digital experience.
Speaking on that topic of primary care costs, this is like the perfect segue into like me wanting to pick your brain about the whole primary care and specifically the virtual first primary care market, because you've been around. I'm sorry, I'm going to reveal the stat there. You told me in the pre-interview chat you've been at 98.6 since 2017. So I feel like you're an expert in this space. Not many people have this kind of a longitudinal view of the burgeoning virtual first primary care space. So I got to pick your brain on the cost side. I feel like the primary care has always had that. The role of primary care, I think, is changing, and I want to get your broad thoughts on that in a second. But before we get to that, I'd love to hear about from a cost side. Do you still think that primary care plays that role that it has it has the reputation for it right now, at least, as being the type of care within the larger scope of care delivery to help improve those outcomes with patients that ultimately lead to a reduction in healthcare costs? Do you still think that primary care is that, silver bullet in terms of reducing healthcare costs? Or do you think maybe that role for primary care, generally speaking, in healthcare delivery is starting to change?
I think I do believe all of what you said. I think primary care is the center. Now, I do define primary care a bit more broadly, probably because of the work I've done, right? Like, I think
How do you
that
define it? How do you define
Well,
it?
I think that, I mean, I think like I include at-home care as part of primary care, right? So then some people may parse that out and say that's a whole new care delivery model. But in my mind, all these opportunities and technologies improve the opportunity for clinicians to spend other kinds of time with patients. There's so much that's subtle and not objective around, it's more subjective around the relationship between patients and physicians. And maybe I'm just an old school doc, but I still think there's subtle value of that trust relationship that matters. And we actually see that internally. As we build efficiencies sometimes that increase the care delivery or decrease the care delivery time, increase the efficiencies around a specific disease process because of the tech we've built, we see sometimes the physicians will spend more time, we would say, like with connective time with the patient. So in statements of connection and empathy, and like ultimately that actually what interestingly has happened in some of these use cases we've looked at, like the physicians say, that's great, the efficiency is good, I'm going to pull it back. And they use some of that time that they've garnered from the tech to just do general connection with patients, to understand holistically where they're at. You uncover behavioral health needs, things going on in their house, other opportunities for you to deliver effective primary care. And that's what primary care docs have always wanted. Like, they're just so burdened by the lack of time, the productivity requirements in traditional brick and mortar practice. We hear this all the time, unfortunately, from the primary care docs we hire. They're just looking for a different paradigm. And so like when the technology actually delivers that experience for them, where they can go back now and spend time uncovering other more subtle aspects of the patient's primary care journey, I think we're winning then. And I think that's the opportunity we have, is to, and then I think from the disease process perspective, it's really easy to point to ED abatement. All digital health companies do, and it's certainly very real. I'm an ED doc by training, although my first digital health CMO job was in 2010, so it's been a while. It's been a while, but
Like, been a while.
I know. Back when it was more M Health and like different terms, and
Oh no, the M Health days. That's terrible, Brad.
yeah, I was CMO for a company called Mobisante, which is like the first FDA approved mobile phone device.
I remember that.
Yeah, it was on a Windows phone, so you can tell where that went. But so but it's just been a long journey to see how we can leverage these kinds of technologies to improve patient outcomes. So I think I'm very excited about the next 5 to 10 years. I think with the data integration pieces getting more holistically completed, startups and companies that have been around a while can finally deliver on what they've wanted to for a long time. I feel like we as clinicians in digital healthcare, have seen the opportunities lie ahead. There's just been so much foundational work that had to be done. Like, if you look at what we had to do, we had to build our own EMR, we had to build our own tools. Some of that wasn't, we had to do direct integration with SureScripts, and all these things that you have to do that take a bunch of time, energy, and money, that now finally we're able to realize and get to some of the other stuff that myself as a clinician are very excited to do: chronic disease management, increased patient engagement, all those things.
All right, zoom out for me even more, because I think what's interesting about, part of your answer there, part of what you brought up was trust. And I'm curious to know what you think is going to happen within primary care broadly, and specifically when we start looking at some of those new entrants into this space. So like the whole Amazon One medical deal, Walgreens, Village MD, CVS Health. I mean, they've got tremendous trust with their pharmacists, and the connection there with Minute Clinic. Some of these people or some of these companies, I should say, that are getting into primary care, in a bigger way. Even some of the digital health startups, or the very boutique virtual first primary care players, whether they're a crossover health or go all the way into Medicare, like an Oak Street, and then everything in between. It seems like primary care is like, there is just a lot of different avenues to get into delivering this these days. What do you think is going to happen to primary care moving forward? Like, I mean, give me like some of your thoughts there. Does the primary care physician still retain that certain level of trust and relationship with the patient? How does technology help this? Is the cost savings that are there still remain? Like, tell me what you think, broadly speaking, happens to primary care in like 3 years, based on what we're seeing happen right now, where it almost seems like a gold rush toward this part of the healthcare market.
Yeah, I think everything that's going on is healthy, and
okay, good.
and
That's reassuring to me, Brad.
yeah, no, and really positive. I mean, primary care is front and center. The spotlight's on primary care. Everyone agrees that it has a significant role in changing healthcare outcomes and lowering the cost, and is a significant area of focus, holistically speaking. And I think there's nothing wrong. And actually, I think it's very healthy for patients to have more choices. So ultimately, like if patients are looking at One Medical as an example and saying this is the place I want to be, then traditional health systems are going to have to ask the question, how do I respond to that? Not from the perspective of, oh, Amazon's coming in. Like, of course, there's that from a business development perspective. But it's more that, like, if patients are selecting A instead of B, we have to ask ourselves why that's happening. It's not just marketing. There's actual things going on in those new care delivery models that need to be incorporated into traditional practices that will be valuable. Ultimately, health systems have a lot of the infrastructure in place to deliver the highest value to patients, in my opinion, because they own all of the subspecialty care for the most part. Like, if you can't deliver primary care in a vacuum very effectively. We started in the early days doing direct to consumer in the state of Washington, and then we did direct to consumer more holistically across the country, and then we moved into our actual work with employers, et cetera. And what we learned is, like, it's really hard to figure out what to do, with someone who's uninsured, in a small town that has no access to cardiology, when what that patient needs is a cardiology referral. But you have to be able to deliver that referral value. You have to understand the ecosystem more broadly, have relationships. And I know that that's going on. Like, a lot of these newer players are partnering with health systems, but ultimately there's still this disintermediation happening that I think health systems are not going to ultimately sit on the side and say this is fine. I think we're seeing that, especially with the large players. They're aggressively going into this space.
All right, wrap this up for us. It sounds like you're going to be helping them make an even bigger fight of it. So that's exciting. But what else is going to happen with 98.6 looking forward? I mean, can you give us any glimpses into what might be coming down the pike over the next couple months, couple years? I mean, what's on the roadmap here?
Oh, thanks for asking that. Yeah, I think we're very focused on delivering this new area of work to health systems right now. But that's a very broad statement. I mean, again, kind of like I referred to before, there's a bunch of stuff you just got to do to make that happen that won't make headlines. EMR, bi-directional flow of information, like that's necessary, but not going to be super exciting to the market. But we're been working hard on chronic disease the last year and a half too as well. So you should probably see some announcements around chronic disease, and our approach is always around technology and automation to deliver more efficient, higher quality, better outcomes programs by essentially, as I said, being in the room of every case. And when you can do new and really exciting and interesting things. And I think we'll continue to do that work and continue to do the work on the care delivery side and grow in the way in which we leverage technology on the patient aggregation side, as I said before. So that's really going to be our focus the next 2 years.
Awesome. Well, Brad, thank you so much for stopping by and catching up with me. I mean, despite how long 98.6 has been around, this is the first time I'm talking to anybody from the company. So I'm very excited to have you here. Thank you so much for joining me.
Well, thanks for having me on the program. I really appreciate it. It's been nice to chat.
We cannot wait this long again to chat. So please make sure you come back, especially around those chronic care announcements. I covered that space pretty extensively. So I'd love to hear what you guys have going on there. So keep in touch.
Great.
Awesome. All right. Well, thank you so much for joining us. That's Brad Younggren. He is the Chief Medical Officer and President of Care Innovation at 98.6. And to check out more interviews with those people who are changing the way that we do healthcare, like Brad at 98.6, you can check out my YouTube channel. It is youtube.com/WTF Health. I'm Jessica DeMoss. I'll talk to you guys real soon. Thanks so much for joining us. Bye.